Good afternoon, everyone. We are thrilled to welcome you all to a special episode of Concorde Conversations. Concorde Conversations is an initiative by Concorde Medical Group to educate, empower, and encourage our community about our health so we can all live to our fullest potential. Today, you are in for a special treat. We are expanding the Concorde community and introducing our very special guests. Today's episode is the Healthy Shoulder Playbook. Did you know that the shoulder is the most commonly injured joint in the body? Hi, I'm Dr. Catherine Weinberg, Director of the Adult Congenital Heart Disease Program at Concorde Medical Group, Lenox Hill, Northwell Health, and I am joined by two renowned colleagues from Northwell Health Greenwich Village, both on the faculty of the Donald and Barbara Zucker School of Medicine at Hofstra University. I would like to introduce all of you to Dr. Peter McCann and Dr. Etan Sugarman. Both are board-certified orthopedic surgeons and experts in sports medicine. Many of you have sent in amazing questions that we will be discussing today. If you have any additional questions, please ask them in the chat box. We only have 30 minutes together, so we're going to try and go through as many as we can. Remember, we are giving general guidance. If you have a particular question about your health, we want to help you. So come in and talk to one of our exceptional physicians so we can answer your question and give your health the attention it deserves. So let's begin. What are the most common shoulder injuries?
Well, first, thanks so much for having us. Most common shoulder injuries fall into two large groups: injuries to the rotator cuff, which are the muscles that surround the shoulder and help our shoulders move, injuries to the labrum, which are structures that help stabilize the shoulder, and arthritis of the shoulder. So I would say maybe three.
Okay. All right, Dr. McCann, what are the symptoms of a shoulder injury?
The symptoms are far and away the most important is pain. That's what patients complain about. And it's particular type of pain where you're actually using the joint and the muscles and the ligaments of the shoulder. Pain at night is probably the most common complaint that patients have, and pain when you're actively using the arm at shoulder level and above. So any overhead sport, even putting on a coat, reaching overhead for a glass in a kitchen, that and night pain are the two most common symptoms.
Got it. So what exactly, Dr. McCann, is a rotator cuff?
So funny you should ask. I use models a lot when I'm in the office. This is a model of a shoulder. Hopefully it's coming through.
It is.
But it's a right shoulder and there's the arm. Under the deltoid muscle, which is the top muscle of the shoulder here, these are the rotator cuff tendons. So the rotator cuff is a tendon, and they're attached to muscles that raise the arm here and above. So that's, if that tendon is inflamed, it's these activities that are going to hurt. You could carry a heavy suitcase at your side and have no symptoms, but can't reach for a Kleenex up at shoulder level. Those are the that's the function of the rotator cuff, and that's where you'll have symptoms if it's injured.
Okay, so Dr. Sugarman, what are the signs and symptoms of a rotator cuff tear, and does every tear require surgery?
Sure. So as Dr. McCann mentioned, far and away, the two most common symptoms are night pain. Okay, and I should say rotator cuff tears don't necessarily need to happen because you fell down a flight of stairs, right? These are types of problems that can just gradually develop over the course of months, if not years. But night pain, or pain that wakes you up from sleep, or pain that you can't sleep on that side, are very common. And that's probably the number one complaint that we have for people coming in. And then pain with activity, pain with moving the shoulder. Not every rotator cuff tear needs surgery. Some benefit from surgery. And the best way to find that out is to speak with your doctor and have him or her look at it and really talk about what you want to do.
All right, Dr. McCann, what are the indications for surgery for a rotator cuff tear?
So the indications are pain and limitation of being able to use the arm that has failed non-operative treatment. Many injuries to the rotator cuff do respond to non-operative treatment, which include taking some anti-inflammatories, giving a period of rest to the shoulder to avoid the activities that hurt, do specific exercises for stretching and strengthening, and in some cases, a cortisone injection. That non-operative treatment solves up to 80% of the problems associated with rotator cuff injuries. And the reason to proceed with surgery is you've done everything non-operative and it still hurts, interrupts sleep at night, and you can't be active using the arm overhead. That's the reason to have surgical treatment.
Got it. All right, Dr. McCann, some of our patients ask, what are the pros and cons of a steroid injection for shoulder injuries?
The pro is that it cures the problem in up to 80% of patients. So the pro is that it makes patients feel a lot better. The contraindication, the downside of it, is that cortisone can interfere with the normal inflammatory process that's part of the body's attempt to heal injured parts. So you can get too much cortisone. No one knows how much is too much. Personally, I don't give more than 2 or 3 cortisone injections in the shoulder, no more frequently than every 2 months, for 2 reasons. One, I don't repeat something that isn't working. And number 2, you can get too much cortisone. And for me, 3 cortisone injections in the shoulder would be my limit.
All right, Dr. Sugarman, patients have asked, what is platelet-rich plasma, or PRP, and how effective is it for the rotator cuff injuries?
Sure. So PRP is a treatment that has been used over the past decade or so, where we are taking your own blood, concentrating down anti-inflammatory factors, and in some cases pro-inflammatory factors, depending upon the type of PRP that we want. So what does that mean? We're taking the blood and we're selecting out parts of it that we think may be beneficial for healing. Does that work? Well, it's a great question. If you look on the internet, there are a lot of places that will say, sure, this is the best thing ever invented. You should do it. You should do it often. It's a cash business. It's a great marketing ploy. The reality is more complex to that. There is data to suggest that this can help. Do we have all the data yet? No, we don't. So what I tell people is that, yes, this can help you, but there is no definitive proof that it will help. And that's really important for people to understand, especially when this is a procedure that is not currently covered by insurance and you're paying out of pocket for it. We here at Northwell are doing quite a bit of research into the properties and the effects and outcomes of PRP. And over the course of the next few years, we will hopefully have more data.
Well, it's a very exciting field, and we'll find out soon how well it really works. All right, Dr. McCann, how often does a shoulder fracture need surgery, and what are the best ways to minimize the risk of developing a shoulder fracture?
So the vast majority of fractures, broken bones in the shoulder, are what we call non-displaced. That means that the parts are close enough together that they'll heal and provide good function. 80% of shoulder fractures have minimal displacement and can be treated non-operatively. The biggest problem with shoulder fractures is stiffness down the line, and patients need to understand that function will improve for a full 4 to 6 months after a broken shoulder. So it's a long recovery because the shoulder has to do more than any other joint in the body. Just think about how much it moves as opposed to a hip or a knee. Surgical treatment is restricted only to those patients who have displaced fractures. And the reason to have surgery is that the function of displaced fractures will not be as good as the function of a fracture that heals in proper alignment.
Okay. All right. What is a frozen shoulder? And is a stiff shoulder the same as a frozen shoulder? Dr. McCann.
So I see lots of patients with frozen shoulder, and the definition of frozen shoulder is a shoulder that's painful and has limited range of motion for no good reason. There are a number of reasons why shoulders get stiff and painful. You can have arthritis, and that'll be shown on an x-ray. You can have calcific tendonitis, which will also show up on an x-ray. You can have a broken bone that leads to stiffness and pain in the shoulder. And a frozen shoulder is a stiff and painful shoulder with no underlying cause. The x-rays are normal, the MRI is normal, and the frozen shoulder is caused by an inflamed tight ligament in the shoulder that usually occurs in women rather than men, typically without an injury. The good news is that 90% of patients with a frozen shoulder are cured with stretching exercises over a 3-month period.
Okay. All right, let's see. Dr. Sugarman, a patient fell on their shoulder about 4 months ago and it still hurts them. Should they see an orthopedic surgeon?
The short answer is yes. You know, we see a lot of people that have injuries. Some are more significant, some are less significant. Shoulder pain that may be there for a few weeks' time that isn't terribly painful, that is not severely limiting your activity, not unreasonable to give that a period of time to get better. But if beyond, let's say, somewhere between 2 to 6 weeks, depending on the severity of your pain, if you're having severe pain, that needs to be checked out. And certainly, if there's pain that's ongoing over 4 months, that really should be evaluated and made sure that there's not something more there that's preventing you from getting back to the things you want to do.
All right. Okay. Can you tell us about what are some of the symptoms that tell me I shouldn't be exercising, that I should stop exercising?
The short answer is pain. You know, and what does that mean, right? Well, it really depends, right? If you've never exercised or you haven't exercised in 6 months or a year, like many of us because of COVID, and then you go back to the gym and you say, okay, I'm going to do the same things that I was doing 2 years ago, even though I haven't done them over the last 2 years, you'll probably have some soreness. And that's normal. But if you're having pain that really is limiting you, that needs to be evaluated. And if you have soreness that is just not getting better despite everything that you're doing, that needs to be evaluated.
Okay. And what about when can you get back to exercise after injuring your shoulder?
The best way that I always explain to people when you can get back is a stepwise progression. And what does that mean? Well, let's take the example of soccer because I think it's just a good example no matter what you like to do. If you twist your ankle and you can't walk, you can't play soccer. If you can walk but you can't jog, you can't play soccer. If you can jog but you can't run, you can't play soccer. So the goal of any rehab, whether it's the shoulder or any other body part, is to be able to take you step by step through the function to the level that you want to play or that you want to act, right? If you are trying to reach a you know, a bottle on a top shelf and that's the goal, that's one type of activity. If you want to play tennis and be able to serve overhead, that's the same range of motion, but a very different activity. And so the goal of either a home program or a physical therapy program that you're doing with a physical therapist would be able to take you step by step through those things to get you back safely and effectively.
Sounds great because we want everybody to go back and play soccer. All right, Dr. McCann, what can I do to protect my shoulder from injury? Are there exercises that I can do to strengthen my shoulder?
Great question, and absolutely yes. You want to work on 2 aspects. One is motion. So you want to do stretching exercises to make sure that you have full motion of the shoulder. And you want to do some simple exercises to strengthen the muscles in the shoulder before you return to an activity where you need to use those muscles. And online, you could certainly find websites that go over shoulder exercises. The most important thing is that you should do the exercises and they should not cause pain. There are a lot of ways to get stronger. It helps to have instruction either from your orthopedic surgeon or a physical therapist, but you can get instruction online as well. The important thing is start stretching and strengthening at a pace that does not cause pain, and then progress, as Dr. Sugarman has mentioned.
Got it. Well, you have some great videos online that I've watched of yours. So
Thank you.
you have some great instructional videos. So Dr. Sugarman, when I have pain in my shoulder, should I ice the shoulder or when should I use heat?
Sure. So the short answer is yes, whatever works. We generally recommend heat for muscle soreness and tightness to help loosen things up, and ice after activity to try to decrease some of the inflammation. From a scientific basis, either one will work just as well. So if you find that in your personal experience, what I'm saying is exactly opposite to what you do that helps, go with what works, not with what I say. The last thing I'll tell you is for shoulder pain, for night pain, we do find that 20 minutes of ice before bed can go a long way in terms of helping night pain.
If I dislocate my shoulder and the shoulder is reduced, do I still need to go in and see a doctor?
Absolutely, 100%. As follows: when we dislocate our shoulder, one of two things has to happen in order for that shoulder to dislocate. We either have to tear the labrum, which is like a hammock that supports the shoulder, or we have to tear our rotator cuff. 97% of the time, one of those two things are going to happen when you dislocate your shoulder. You are also at risk for breaking the bone, which can put you at risk for recurrent dislocations and ongoing problems. The safest way to treat that, decide if you have any of these problems and do they warrant further intervention, is to be able to be seen. And we generally recommend being seen within the first 1 to 2 weeks after a shoulder dislocation.
Yeah, Catherine, I think it's important for patients to understand that a shoulder dislocation is a big injury and requires treatment. It doesn't always require surgical treatment, but it certainly requires treatment that can be recommended by a specialist. So it's important to be evaluated.
All right. We have a question in the chat box. Can you explain a bursitis? What is bursitis?
I'll tackle that one. Bursitis is a common term for inflammation of the rotator cuff tendon. So the rotator cuff is a tendon, and I explain to patients that the tendon can just be inflamed from overuse and still be attached. The tendon can be frayed and have partial tearing in it, and a tendon can be torn and pulled off the bone. So we talk about it in the orthopedic literature about 3 phases of bursitis. One is inflammation, partial tearing, and full thickness tear. So bursitis is a general term for rotator cuff injury.
Got it. Dr. Sugarman, there's a question in the chat box. AmnioFix, what is it and is it helpful?
Sure. So AmnioFix, and that's a particular trade name, is a type of amniotic fluid injection. These are generally amniotic fluid taken from live births that are very rich in anti-inflammatory factors and that have been used commercially as a what we call biologically friendly anti-inflammatory in a way similar to PRP or platelet-rich plasma. There is some data to suggest that these can be helpful. However, similar to PRP, we don't have good long-term high-level data to show that this is 100% the case. These are experimental treatments. They're not covered by insurance. There may be a role for them. Here at Northwell Orthopedics, we're actively researching these injections, and we are participating in a trial of a different brand amniotic fluid injection at this current point. But the best way to decide if this is going to be useful to your shoulder is to have a conversation with a specialist who's familiar with it.
Got it. All right, there's another question in the chat box. Dr. McCann, how long would it take for bursitis to heal, even if you're doing PT?
It depends on the extent of injury. Sometimes an overuse, doing too much tennis or working out, that kind of inflammation can resolve in 10 to 14 days. The more serious injuries, if there's a tear of the rotator cuff, I recommend that patients commit a minimum of 3 months to non-operative treatment. So by 3 months, you should really have cured the problem. And after 3 months of treatment, if you still have pain that compromises life, you can't sleep, you can't wash, you can't dress, you can't do your sports, that's the time to talk about surgical treatment because you've failed non-operative treatment. So 3 months.
Okay, great. Dr. McCann, how can you tell if you have arthritis in your shoulder? And are there any steps you can take to prevent it?
You'll know if you have arthritis because you'll have the same complaint as with other shoulder problems, the most common being pain at night, as Etan has mentioned. With advanced arthritis, you're also going to have stiffness of the shoulder, so you have limited ability to reach overhead. And if you have bone-on-bone arthritis, you'll have noise in the shoulder when you try to move your shoulder, and that'll be painful as well. You can have arthritis and not have severe limitation of motion, and that's why an evaluation by a shoulder expert and an X-ray will establish the diagnosis.
All right, Dr. Sugarman, what are the best ways to maintain good posture and avoid slouching?
I always say to people in New York that it's very rare to find a New Yorker that's pulling a plow in a field. And the muscles that we use, right? We think about our shoulders, we have muscles in the front, like our pec muscles, and we have muscles in our back. And most people in New York like to sit at a desk on their phones or typing at a keyboard. And that works the muscles in the front of their shoulders, but not in the back. The best thing to do is, one, have a good setup, right? Have an ergonomic setup where you are not overly straining yourself. Your keyboard is at the right height. Your chair is at the right height, you have good support in your feet, your computer monitor is at the right height so that you're not straining your neck, because all of these things play into how our shoulders, how our body functions. Beyond that, exercises to maintain strength in our muscles help, right? Keep the muscles awake. If you don't use them, you lose them, right? Same thing we were told when we were teenagers applies to us nowadays as well.
Good. All right, Dr. McCann. Let's see. There was a question about a sling. Will a sling help a torn rotator cuff? And if so, should you sleep with it on?
I only use slings for an acute injury like a broken bone and anytime patients have surgery on the shoulder. I find that patients who have rotator cuff injuries actually feel worse in a sling. And what I recommend is let the arm dangle at the side, let it swing when you walk, use it below shoulder level for everyday activities, but don't do activities that cause pain, which is actively raising the arm. So I don't recommend sling for rotator cuff injuries because I want the shoulder to move and not get stiff.
Okay. Dr. Sugarman, another question from the chat box. If you have a tear or a frozen shoulder and have gone to PT, is it okay to go back to sports activity or will it make the tear worse?
Yeah, so I'm guessing, I think that is if you have a labral tear and frozen shoulder would be my guess. And the short answer is it really depends. It depends on your particular labral tear, and it depends on what type of sport you go back to and your age. All of these things have been shown to be directly related to your risk of re-injury and making the problem worse. So in general, if you're young, if you participate in contact sports, and if you've had multiple shoulder dislocations, you can certainly make it worse without proper treatment. What that treatment is may be surgery, may not be surgery, but you have to have that evaluated.
So Catherine, I would add to that, this question comes up all the time after you treat patients with shoulder injuries. And my criteria for getting back to more vigorous activities is solely related to pain. And akin to Etan's description of getting back to playing soccer, you get back to the gym, for example, and you start at 10% of whatever exercise you were doing before. You test it, doesn't hurt. The next session back, you do 20%. And over a 4 to 6 week period, you get back to full activities, provided that you don't have pain. So avoidance of pain is key.
All right, sounds good. So if you had one action step to recommend to our viewers to improve their health and start today, what would it be, Dr. McCann?
I would say activity and mobility. You have to commit to 20 minutes of an exercise program, and it doesn't matter what it is, but it has to be 20 minutes and a minimum of 3 times a week. So 20 minutes 3 times a week doesn't sound like a lot, but it is. You have to be consistent. You have to do enough, and you have to do it on a regular basis, and it has to be part of the lifestyle that you have, and hopefully something you enjoy doing, because if you don't enjoy it, you're not going to do it. So 20 minutes of activity 3 times a week.
And as a cardiologist, I can concur with this. So Dr. Sugarman, what's your answer?
Mine is small steps, right? We all say the same things. Diet and exercise go a long way, and you're not going to go and change your life completely overnight, and that's probably not going to work. But you take small steps, you commit to a moderate amount of exercise, you commit to moderate changes in your diet, and I think that can really add up.
I agree. So thank you all for joining us for another inspirational and educational episode of Concorde Conversations. A very special thank you to Dr. McCann and Dr. Sugarman for joining our conversation. We appreciate their time and expertise and to help educate, encourage, and inspire our community. So thank you. Please remember to fill out our survey and let us know how we're doing so we can serve your needs better. If you have additional questions, we want to help you. So come in, make an appointment so you can speak with these extraordinary physicians. We care about your health. We care about you. Thank you for joining us.
Thank you all.
Thank you for having us.